Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to enhance your overall understanding of information provided to you, because when you know more, you are empowered to make better decisions, to enhance yourself and your loved ones for a better quality of life. And I am lucky enough to have Jan Hansen on, and she is a physical therapist from Advanced Therax Rehab in Woodbury. Welcome, and thank you for coming back.
It's nice to be here again,
Yes.
Tina, thanks.
And on our last show, I guess you got a few patients from the phone calls?
Yes, it was very, very nice. In fact, one patient said that she was watching TV at 2 o'clock in the morning. And I think I told you about that. And I'm like, well,
Yeah.
I don't know how many people heard that one, but
Yeah.
she did.
That's great, and she came
Yeah.
to you, and now, wow, it's so great that you can enhance her quality of life too. And that's what this show is all about, is to get this knowledge out to our viewers. But before we do that and we go ahead and talk a little bit, I'd like you to tell our viewers, maybe they missed our other show, a little bit about yourself and
Okay.
of course your love and your passion. You are a licensed physical therapist, and you also took it a step further too. So,
Right.
yes.
I am a licensed physical therapist, and I have been practicing for 30 plus years. And over those years, I have seen our field change a lot. And during that time, I have spent more and more time working with patients that had chronic or acute pain. One of the issues is that very often people with pain really have a hard time finding treatment, and are very often told that there may not be any help for them. They might have to go live with it. They might be taking a lot of medication, which can be expensive, but also have a lot of side effects. So in my practice, we use standard physical therapy treatment techniques, but we've also added some newer techniques. And our patient model that we use is a little different because we try to look at the whole body. We look at the body structurally from the feet up, because you really cannot separate the knee from the hip from the back, and etc. So it's really important to look at the body as a whole, because it's such an intricate machine. And so recently I found a couple of techniques that have given me much greater success with treating some of the really difficult types of problems that patients come to us with. And again, most of the people we see don't just have one type of problem, they may have multiple problems. So it's important to address all of those at the same time.
Yeah. Instead of just putting a Band-Aid on one little fix.
Right,
you
we're
look at the
not
body
going to
as a
zero
whole.
in on just the knee, because the knee may affect the hip or the back.
Yes.
And the other reason that I'm here again, I think, is because we want to talk about hope and maybe what some patients think when they've been struggling for so long. And I hear often stories of, I've been through all my retirement money because I can't work, or I've given up, I can't go to my grandchildren's football games because I can't stand out on the football field, and all those things that impact people's lives.
Right. The
So
quality of life isn't there. What they thought they were going to have as they got older, it was all kind of taken away from them a little bit.
right,
Yeah.
and it's a huge, huge loss for most people and for the whole family.
Yes.
And beyond that, it is when people are told there's not much else that can be done, it's sad, because we know that there are some things that may very likely help.
Right.
So,
And for someone to say, no, you have to live with this, and then you're thinking, oh, and then you feel so inadequate. But yet now people are finding that they're doing a little bit of their own homework, and they're going with alternative medicine. And this is something that's not actually normal, or a lot of people aren't aware, I guess I should say more, of what you offer. And so this is a great thing. And I also understand that you have one of your patients that wanted to come and talk a little bit about her own personal story, because you've changed her life a lot. I don't know that it's so much a miracle worker to you, but to her I'm sure it is.
And I thought it would be nice too for the viewers to hear her story, because they may really identify with some of the things that she has experienced.
Okay, great. Well, I guess your guest is Joan.
Yes, it is.
So, Joan, I'd really like you to talk a little bit about yourself and give out your testimony to the people, so that if they happen to be in your shoes, you know, they can know that there's a little bit of hope. Yes.
Yes. I think I will begin with where I was before I came to see Jan.
That'd be perfect.
And I spent last winter wrapped up in a blanket with a heating pad in my recliner, because I had no energy. I just hurt all the time. It was really a time of grief and loss for me, because I couldn't do anything. I really couldn't. And
no one could help you.
Well, no, and the doctors would try this pill, that pill, another kind of pill, and all it did was make my stomach bad. So that wasn't working at all. And then my doctor recommended that I see Jan, because she had alternative care. And my first reaction was, forget it, I've done everything else, nothing's working, why should I do this?
Well, and then you think of a physical therapist. What can a physical therapist do? Because you're aching inside and out and all over. And you think of a physical therapist as, you know, a hip replacement, you know, something like that, a rotator cuff, you know, that kind of variable. And then the doctor tells you to go see a physical therapist.
Yes.
Wow.
He told me that Jan used a different approach. But he needed to tell me to go twice.
Oh.
At first, I wouldn't. I don't know. I think Jan called me, but I ignored it.
Okay.
And then I was back to the doctor again, and he said, I really think you need to do this. So I went. Then Jan called me, and I made an appointment.
Good for you.
Yeah.
Because we all need those people that kind of push us sometimes. And I'm very proud of you.
Yeah, I'm so thankful too. I just, my fibro was so bad last year, and I mean, I've had a bit of a flare after I was very sick with bronchitis, and that kind of changed my immune system some, or whatever, took a lot out of me, and so I had a bit of a flare, but it nowhere near does it compare to what it was last year.
Wow. So can you back up for our viewers? Because I don't think that they know exactly that you were diagnosed by a doctor with fibromyalgia.
Right.
And then you were also told that you had to live with it.
Yes.
If that's correct.
Yeah, that's absolutely right.
Right. And
So that's not something that you know, that I wasn't ready to sit in my chair the rest of my life.
no. And I'm sure your family didn't want to see that.
Oh,
either.
no, it was, though my husband is very understanding and very kind, but it gets old real fast. And so when I finally found Jan and started being treated in her, with her techniques, I started to get better.
Wow.
And to begin with, I was sleeping probably 4 hours a night at maximum. I hurt so bad. I couldn't sleep in the bed. I couldn't sleep in the chair. It was really not good.
And that's basically how your body heals.
Yeah.
You know, from sleeping.
I was
only
so
for 4 hours.
yeah.
Oh my stars.
Yeah, I was so tired all the time. And then to this point, I am sleeping a good 8 hours a night.
Oh, wow.
I mean, it is just, and I get up with energy. I can tackle the things that I want to do during the day. And sometimes now in the last, since September, I've been needing to rest a little bit during the day. But, I mean, that doesn't even count compared to what it was last winter. So I just really, I'm just doing so well, and I'm feeling so good. And